This episode contains discussions about opioid addiction, drug use, and mental health, including references to substances such as fentanyl and heroin. These topics may be triggering to some viewers. Viewer discretion is advised.
Welcome to Health Simplified, brought to you by Sentara Health Plans, where we improve health every day. I'm your host, Bradley, and I'm so glad you are here today. No matter who you are or where you are in your health journey, this is a podcast designed with you in mind. In this episode, we're diving into the opioid epidemic, a pressing issue impacting individuals, families, and communities. Joining us today is Shambri of Sentara Health Plans, an expert in behavioral health and substance abuse, to give you the answers you are looking for. Well, thank you again for joining us, Shambri. What inspired you to focus on substance abuse with your mental health and behavioral career?
Well, Bradley, I grew up in Norfolk, Virginia, and Norfolk is a military town. So we have a mixture of individuals from all over the world, and we are heavily populated with veterans. And so I witnessed growing up a lot of individuals, particularly veterans, who were plagued with substance use disorders and who also suffered from sometimes undiagnosed and then other times diagnosed mental illness. So that inspired me to want to get involved to see how I could be of help in impacting and improving these individuals' lives.
Okay. Well, I'm glad to hear this coming from a local in town and aware of how our community is operating and struggling with this opioid addiction. You talked about veterans, but what is the youngest case that you've come across in your career?
Okay. Sadly, Bradley, the youngest of my patients, was 13 years old, and he was addicted to heroin, and he was using intravenously.
So intravenously, just simplify it so I understand, was it?
Via needle.
Okay.
So it's referred to in the streets as like shooting heroin, and so that's the quickest mode of getting the drug into one's system because it goes right in the bloodstream. So there are different methods that individuals can use substances. Like heroin, they can use it intravenously, where they use a needle and inject it right into their vein, and it goes right into their bloodstream. And these are really individuals who are further along in their addiction because they're looking for that immediate effect.
But just to reset and for us to have an understanding, like, what is an opioid?
So an opioid is a drug classification that is designed to treat pain. There are some naturally occurring opioids and also synthetic opioids made in the lab. So natural occurring opioids are your opioids such as like morphine and heroin. They are, again, derived like naturally. But then we have lab-made opioids like fentanyl. So, and then opioids, like, again, they encompass our pain medication from hydromorphine, Dilaudid, Percocet, oxycodone, to heroin and fentanyl, and then more stronger carfentanil.
Shambri, thank you for going over the different types of opioids and how that's been impacting our community. So you've talked about two different age groups, but like, is there a certain age group that's highly impacted by the opioid usage or an addiction? Just to get a better understanding of which age group is really struggling with this.
Yes, Bradley, that's a great question. And the devastating reality is that it affects everyone from all walks of life, and it ranges from adolescents all the way into to elderly individuals. So, with social media glamorizing, drug use, we have an increase in adolescent opioid use disorder because the adolescents are seeing that their favorite celebrities are partaking in these drugs, and so they're trying them. So it hits that age group, but then it also spans through, of course, people in middle age, but elderly individuals as well. A lot of opioid use disorder starts with prescription medications. So we have a lot of our elder community who are prescribed these opioids to treat pain, or if they, or just something like an acute fall, and they become addicted because of the euphoric effects. Opioids cause an intense pleasure, in addition to nulling the pain.
For the pleasure that you're talking about, can you go into a little bit more detail on what that feeling is? Because I know you're talking about prescription or recreational, and it seems like some individuals might not know they might be developing an addiction or a problem with opioid use. But when you're talking about the feeling, what is that entailing or really all about?
Okay, that's a great question, Bradley. I'm glad you asked that because, opioids is a drug class that is used to treat pain. And so what happens is their dopamine is, released in the brain. And dopamine, as you know, is our body's pleasure response. So in addition to the opioid impacting the brain receptors in the sense of nulling or dulling the pain, it also gives a rush of dopamine. So when we have a rush of dopamine, that's like pleasurable. So you feel good, you feel, unstoppable. Some individuals have described to me that they feel like a Superman or Superwoman effect. Whereas, if they were suffering with like anxiety, they feel like they can do anything because they have that sense of pleasure, that euphoric sense where they're confident, they're brave, they feel good. And then if you pair that with someone who's, have an underlying depression, this is the first time that they may be feeling well or even a pleasure in a while. So it's easy to see why an opioid would be highly addictive.
So, just so I understand, it's affecting the brain and how you're feeling. So, technically, it's not fixing the problem. Is it masking or?
Yes. So it's intended to null or dull the pain sensors in your brain. But because it also releases dopamine, it can and it will cause a euphoric feeling.
Okay, so that's the extreme high or low.
Yes, because when that person is receiving or they're in the middle of a dose, they are feeling euphoric. But when that medicine tide starts to wean off, they'll feel dysphoria. So that's when they go on the other end of the spectrum where they're feeling, not so well. They're feeling sadness, maybe anxiety, a little depression, and then of course pain if their intended use was to treat pain.
It's very interesting to kind of get that description of how the body's responding to that type of treatment. So you've given us so much information of what you've experienced over the years in your line of work, but how has opioid addiction and use changed throughout your career?
Opioid addiction has changed dramatically because there's different waves. For instance, in the 1990s, the primary mode of opioid addiction was an overutilization of prescription pain medications. And then in between the years of 2010 to maybe about 2014, there was a higher increase of heroin. From 2014 upward, now we're seeing an increase in fentanyl. So there are different, all of those fall under the drug classification as opioids, but it changes. We've seen a change over the years.
Okay, so it seems like we went from the prescription and then it's kind of led into, or the trend is now more recreational. Is that how we can understand that?
We can understand that way, but just keeping in mind that even prior to like this uptick in the last 20, 30 years, opioid use disorder is nothing new. We had it sweep through Harlem in New York in the 1920s, during the Renaissance period. So it's nothing new, but that reemergence in the 1990s was again due to an increase in prescription medications. Prescribers, our physicians, were not made aware at that time that certain prescription medications that they were prescribing for pain would be as highly addictive as it was. So then you had, an increase of individuals from, working class people to housewives being prescribed for, just minor things to treat minor pain. And most of the times, it was ailments that could have been treated with non-opioid medication.
When it comes to pain management, what can we be equipped with the types of questions to ask our primary care physician when opioid prescriptions come into treatments or conversations?
Probably that is a very important question. In my work, what I found is that a lot of times individuals are afraid to ask their prescribers questions, or when their prescribers or physicians explain the medications that they're going to be prescribed, and the side effects, and how to use them, they don't have a clear understanding. So if someone is not able to clearly understand, I found that they're less likely to ask any questions because they don't want to come off as someone who's not intelligent, or doesn't understand that there's an embarrassment factor. And so I try in my work to encourage my patients that there's no dumb question. Ask questions. If you don't understand, ask your physician to break it down to you. That's what they're there to do, and they're happy to explain it in layman's terms if you don't understand. I also encourage them to ask, if they're being prescribed a pain medication, if there is a non-opioid medication that could be used as a starting point, and then if that is not effective, that they could come back and either increase that dosage or transition to something that might be a little stronger and more effective in treating whatever ailment they are experiencing. If it's someone who is also experiencing like mental health issues, and let's say, for instance, they have anxiety or social anxiety, and they freeze and aren't comfortable speaking in public, I would ask them, hey, do you have a close family member or someone who can act as an advocate or support to accompany you to that appointment, so that you're comfortable with receiving any diagnosis and recommended treatment, but B, that's there to support you to ask the appropriate questions. So, we want to start with asking, what are the side effects? Are there, what's the potential for abuse with this medication? And then, is there a non-narcotic medication that can be used in lieu of whatever opiate the doctor may be wanting to prescribe?
Okay, and then also, because you mentioned having a family member or close friend to be with you at your appointments to provide that extra support. So it seems like communication and understanding and support is needed in certain times of dealing with certain treatments. Is that correct?
Absolutely.
Okay.
We want to be able to understand what's going on in our bodies. We want to be able to get to a calm state where we can receive that information, process it, and then understand our next steps. And if you aren't able to do that, or think that you need additional support, there's never a problem with asking someone. And they even have patient advocates in the hospital system. So if you don't have a family member, a close friend, a mental health worker who could accompany you or support you, ask for a patient advocate, and someone will be able to be with you during that time and assist and help you to ask those difficult questions.
I wasn't really aware that was an option or available. And so I have a better understanding. Is that something that you can, during an appointment, call on, or can that be like scheduled, or does it depend on the hospitals or the care provider for that patient advocate?
It does depend on the facility. For instance, if it's, if someone is seen in the emergency room, they can let their nurse know, like, hey, I have difficulty understanding, or I need additional support. And what they'll do is they'll get the social worker on staff to accompany that individual during that appointment. If they're, doing different hours, they may have that patient care advocate on standby or on call during that time. But if not, there's always a hospital social worker who's happy to step in to provide that additional support.
Wow, that's great that at a whim or when needed for that's an opportunity to have that support. So especially with how sensitive it is, not reaching out to a family member or a friend and how critical a case may be.
It's very interesting that you mentioned that. So, if we have an individual who might be struggling with an opioid or any substance use disorder, they may be reluctant to call upon a friend or family member because a lot of times it's shaming and they're hiding that addiction. So, just having an external support. It's very helpful, and people need to know that they have that available to them. You don't have to suffer in silence. You don't have to go through alone. So again, if you haven't disclosed your addiction to your family, or most of the time families suspect, but if you aren't comfortable addressing that or acknowledging that with your family, there's always an opportunity for external support.
And with what you've just explained to me, you've brought up the word addiction. And I know that's hard for some individuals to realize or understand. When it comes down to it, how would you know?
So with opioid use disorder, it's very unique and different from other substance use disorders in that opioid use disorder or opioid addiction is a physiological addiction, meaning that you not only have that psychological component, but you also have a physical addiction. So when you're using opioids, your body develops tolerance. And with tolerance, that requires one to use more than the initial use in order to feel well or normal, or even that euphoric state that they initially felt upon first use. And so, with that, the body, when absent from that opioid or receiving a decreased dose of that opioid, the body will start to exhibit physical symptoms of withdrawal. And that includes anything from like a runny nose, itching, fatigue, depression, dysphoria, diarrhea, constipation.
The whole body is going through a change.
Absolutely. Wow. Absolutely. So that's why opioid addiction is one of the what is considered one of the worst addictions, again, because of that physical component in addition to the psychological component. It makes it much more complex than any other substance use disorder.
Wow. So if someone's in a position that they think they might be addicted, is like cold turkey an option? Or, I mean, I know we're going to go into resources eventually, but just knowing when you come to that realization, what's the next step, and can they do it on their own and just stop?
So, this is a very important part of the conversation, Bradley, because um, my recommendation as a substance abuse counselor is to always seek medical assistance. And I say that because if one were to stop taking it, of course, they would go through all the withdrawal side effects that we just discussed. But also, if they have an underlying condition, for instance, if they have hypertension or diabetes that they may not have been treating because they were so engrossed in their addiction, it may trigger other issues. So you always want to err on the side of caution and seek medical help. But yes, one can wean off, cold turkey. It's not effective a lot of times with opioid use disorder because without the medication assisted treatment, most people are more likely to return to use at some point.
Wow, that's a lot to process, but it seems like it is a process to recovery.
Bradley, individuals will be in recovery for the rest of their life. So, when we talk about, recovery, what does that look like from opioid use disorder? Well, we've already discussed the physical ramifications of withdrawal.
Yeah.
So, the reason that individuals who do it cold turkey usually return to use is because when they detox, if you will, from the physical portion of the addiction, but we haven't addressed the psychological. So it's always, again, recommended to seek medical assistance because, again, the doctor can oversee that process and at least get you through the physical detoxification portion in a healthy way. So you're monitored during that detox to ensure that, again, any underlying medical condition that one may have is not impacted, because when you're detoxing, that may cause, a decrease or increase in blood sugar levels. And so that wouldn't be great for someone who's diabetic. It could cause a decrease or increase in hypertension. That wouldn't be good for someone who's diagnosed with, hypertension or any other related health issue. So once you get through that detoxification stage, that's just one step. Now we have to address the psychological component. What sent this person to that addiction? What maintained them in that addiction? What was their catalyst to continue to use despite the negative impact that it had on their life? So we want to address those triggers. We want to address, the precipitating reason that led them to, even trying an illicit substance if that was, how they got started. Again, some individuals start off with, being prescribed pain medicine. Some people, start off recreationally, and some individuals are running from trauma. They're running from other mental health disorders like depression, anxiety, different things like that.
Thank you again, Shambri, for going over how as an individual I can understand that I could be developing an opioid addiction, but it seems like this is impacting our community and families. But how can a family member, maybe if they're questioning if a loved one is addicted to an opioid, what are the signs that are external that from the outside we can see if our family, friend, loved one could be experiencing this and they don't even know it? What could we be on the lookout for to just see if they need help or how to support them?
So, family members may take notice that their loved one is distant from social or family engagements, that they have shown a decrease in their hobbies or interests, if they are having financial issues, if they're missing work, if they're missing school and not meeting their obligations, if they are, appearing disheveled or unkempt, if they are, displaying erratic behaviors, mood shifts, if they are irritable, if they are at, say, for instance, if they're at a family event and they come in and they're in this state of euphoria where they're really working the room, if they're highly engaged with everyone, they're, talkative, especially if it's someone who isn't as, much of a social butterfly, but then at some point during that same event, they become highly agitated. If they display a short fuse, if they are, snappy with people, if they start to withdraw from their, once socially, if that work in the room, that sense of work in the room, if they, kind of experience some withdrawal from that state, if they are leaving family functions early again or missing them, you can kind of tell that something is up. Physical symptoms, if you start to witness that they are, itching a lot, if they are, drowsy, they're having that dilated pupils or runny nose, those types of physical symptoms, in addition to changes from their normal state of being.
And as we've gone through this conversation about opioid use and addiction, and we've talked about the highs and the lows, and it seems like the tendencies of someone on it would show an extreme high or a low of behavior patterns that are not their norm.
Yeah, they're very inconsistent with who they were before use. Absolutely.
Okay, that's good to like understand and clarify. Um, what would be your advice to a family member if they're seeing it and how to approach that conversation or navigate that with other family members or one-on-one? Like what would in your experience be the best advice to really show support, love, and care for that individual going through this?
Exactly what you said. Show support, love, and care. Start with a one on one conversation with that individual and let them know, for instance, hey, Jim Bob, I noticed that, your finances are kind of in disarray at this time. I've noticed that you're missing a lot of work. You're not as engaged in, your social activities. You go, what's going on? And I just want to let you know that I'm here to support you, and I've taken notice of this because and I'm bringing it to you because I love you and I care about you, and I just kind of want to know, is everything all right? Now, of course, that individual will probably be in denial. Most likely, they'll deny it. They'll probably get agitated and frustrated that their family member has even approached them with that. And you can't expect honesty, and so if they aren't forthcoming at that point, if they're in denial at that point, then the next stage may have to be a family intervention, where, one or two members of the family come together with that individual and tell them, like, we noticed that something is going on based on this, excuse me, set of symptoms. Um, and we're really concerned, and we want to let you know that we think that you may need some help, and we're here to support you. Sadly, a lot of individuals have to hit what we would call in the treatment realm as rock bottom before they're even open to admitting that they have a problem. But again, family and friends, it's always of the utmost importance to try to display that support and to try to talk with them and intervene, if you will, even if they aren't receptive yet. Continue to let them know that you love them and you support them. Continue to check in on them.
And it seems like from all of our discussion we've had today that there's going to be a need of constant support, because you had mentioned about the physical aspects of opioid addiction, but also the mental, which to my understanding would be causing the relapse or to seek out opioid use again. Is that correct?
That is correct.
Okay. Thank you for clarifying for that.
Abs-
Shambri, you mentioned about rock bottom, and I know we've heard that in all avenues, even in life, but you're using that term as we discuss opioid use, like when you've come across cases or individuals that hit rock bottom, like what is that?
So, what I've noticed when individuals hit rock bottom, to me, that demonstrates that they are out of options. So many people are functional in their addiction for a period of time. They hide it. They're still able to go to work even if they're late and having behavior issues at work. They're still able to engage in their parenting responsibilities, engage in different other social obligations, even if it's in an altered or impaired state. So when someone hits rock bottom, this, looks different for everyone, but someone who may have lost their job, someone whose spouse has decided to file for separation because they just can't take the addiction anymore, someone who's lost custody of their children. I've even had some women tell me that they knew that they were at rock bottom when they got to a point where they were willing to engage in sexual activities in exchange for the drugs. So again, rock bottom looks different for everyone, but it encompasses really just a loss of support, a loss of avenues that will help mask that addiction, a loss of who you were prior to that addiction. Your job, your friends, your family, finances, a loss of savings, a loss of a house because of addiction. So just things that have been taken away, or things that you have lost as a result of engaging in addiction.
And that loss can be one or many the examples you provided,
So
and it would be that constant build, I guess.
it could be, yes, a loss of, again, finances, a loss of, a sense of security, a loss of dignity sometimes, again, when people end up, engaging in things that they would have never done, sex work in exchange for drugs, criminal activity, a loss of your freedom. Sometimes it's someone's rock bottom. Um, a loss of your social standing, because when we talk about the opioid addiction and we, mention that it affects everyone, this means everyone. So people with, high social, jobs and duties, people who are in the health profession, people who are teaching, people in clergy, it affects everyone. When we think about the sense that opioids are prescribed at times to treat pain, well, we're all susceptible to pain. Any of us could be prescribed an opioid at any given time. Um, because we don't know how we will, respond to it. Some people have a genetic predisposition. Some people are socially vulnerable in that they have been exposed to substance use in their life. And so, because of that, they're more likely to continue to use. Some people, going back to the genetic predisposition, that's genetic. You don't know how your genealogy works. And so if I'm prescribed something and I take it, I may just be that one person who just becomes addicted immediately because that euphoric feeling is just so great, or the way that it works on my brain receptors is different from someone else. And so I am more likely to develop that addiction. So there are so many precursors or causes that makes us more or less vulnerable to addiction. So when we think of it from, that standpoint, it can happen to anyone. But the important, thing to focus on is a loss of who
Okay.
they once were.
Okay. Thank you. I really appreciate you painting that picture, as hard as it is, that would be enough for an individual to realize their struggle, but also a family member or a loved one to understand if their significant other or family is dealing with something like this. That's a lot that builds up to that loss, and that's what it seems like it comes down to, loss.
Yes.
The conversation today, all the information and the topics we touched on, Shambri, was a lot. I really appreciate the information and sharing that with our listeners and viewers today, and you taking the time out to really help us understand what's available to us in Hampton Roads. So thank you for your time and thank you for your knowledge. It's been a pleasure.
Thank you, Bradley. It was a pleasure for me to be able to share my experience with you. And because opioid use disorder is so multifaceted, from the addiction to the triggers, treatment, I hope that you'll have me back so that we can expound on some of the various facets of opioid use disorder. So I look forward to you inviting me back.
Definitely that I hope to have you back. And I think we just touched the tip of the iceberg for everything that opioid addiction and use has impacted our community. So
Agreed. So I will see
until
you
next
soon.
time.
Until next time.
Thank you. Thank you so much for tuning in to Health Simplified. We hope this episode shed light on the opioid epidemic and provided you valuable insights to make informed decisions for yourself or your loved ones. Remember, if you or someone you know is struggling with opioid dependency or addiction, help is available. Talk to your healthcare provider or explore local and national resources to get the support you need. We will link to some important resources in the description of this podcast. If you enjoyed this podcast, please hit subscribe and follow us for upcoming episodes.